Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, May 28th. I want to acknowledge that we're on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. I wanted to note that at 7:15 tonight, Northern Health is holding its virtual town hall. CEO Kathy Ulrich and Chief Medical Health Officer Dr. Raina Fumerton will answer your COVID-19 and surgery renewal questions. MLAs Jennifer Rice and Coralie Oakes are the hosts this evening, and we thank them and their guests for providing this helpful session. You can see it, the town hall, at the Government of BC's Facebook page or at the Province of BC's YouTube channel. If you don't get a chance to submit your questions ahead of time, which you can ask your questions during the virtual town hall on the BC Government's Facebook page. Dr. Henry will be doing a briefing on Saturday at 1 p.m. Here. Tomorrow, Friday, we'll be releasing a written statement at 3 p.m. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So this is our update for May 28th on the COVID-19 cases here in British Columbia, and we have 9 new people who have tested positive in the last 24 hours, bringing our total here in British Columbia to 2,558 people. That includes 899 people in Vancouver Coastal Health Region, 1,274 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 195 people in the Interior Health Region, and 63 people in the Northern Health Region. We unfortunately have one new healthcare related outbreak in a long-term care home in the Fraser Health Region in Nicola Lodge, with a single case so far, and I know Fraser Health are actively working with the home to ensure that we contain this as quickly as possible. There are now 16 active outbreaks in our healthcare system, including 15 in long-term care or assisted living and 1 in acute care, and that includes 550 cases, 338 residents, and 212 staff involved in those outbreaks. On the positive side, we have no new community outbreaks, and I'm really pleased to say that today the outbreak at the Mission Federal Correctional Facility has now been declared over as of yesterday, which means we have no new cases for 2 incubation periods. And as you know, that is one of the largest outbreaks we've had in the province, and it took an incredible effort. And I really want to commend the teams from Fraser Health in particular, from BC CDC who supported them, from the mobile medical unit, but the immense effort that people put into ensuring that people in that correctional facility had access to what they needed to control this outbreak and were cared for and supported through this last very difficult number of weeks. It required a lot of coordination as well with our federal partners, especially Correctional Services Canada and the Public Health Agency of Canada, and the protocols that were developed have really been now expanded and put in place in federal correctional institutions across the country. And I think that's a really testament to the amount of effort and expertise that we have in the province to support this type of outbreak response. We have 241 active cases across the province right now. Of those, 33 people are in hospital and 6 people are now currently in critical care or ICU. Unfortunately, we have also had 2 new deaths in the last day, both of them in long-term care in Fraser Health. And I know how challenging the situation is in long-term care when our elders and seniors are afflicted with this virus. And our condolences go to the care teams who are trying so hard to support people, to the families, and to the communities who love these people. We now have 2,153 people who are fully recovered from COVID-19. As you know, we are in our restart, and we're a little after 1 week in our restart program. And as we know, COVID-19 has a 2-week incubation period. And we know as well, we have learned that the virus can be passed on from someone who is asymptomatic or early on in their symptoms or has mild symptoms and may not realize that they are ill. We are carefully moving forward into this phase 2, into our restart, and we are watching for new cases closely, and are assessing our progress week by week. And we're doing that through our testing, through our contact tracing, through making sure that we're managing all of the outbreaks and the cases. We need to get comfortable with our phase 2 before progressing further. And as things are progressing in the last week, we've seen that. We are becoming more comfortable with our social interactions, how this looks and how this feels. Businesses are reopening. And next week, in another major important event, in-class schooling will start again in many parts for many children across the province. And as we know, that will be a mixture of in-class and at home with smaller numbers. It will look different than when school let up in March. We have a good understanding of how we're doing. We will have a good understanding of how we are doing around mid-June, when we've had these couple of incubation periods. We'll have the data that we need to determine our timing for the further actions. And our slow and thoughtful approach will continue, as that is our new normal. It's grounded in what we know about this virus today, and will continue to be adapted as we learn more about this virus in the coming months. And that is how we're going to make it through this phase, through our summer, and should we need to, how we will be looking at this into the fall. I also want to say that I have updated one of the PHO orders on vending markets, and that was published today. So vending markets are what we commonly know as our farmers markets, and as you know, we had some restrictions on those. And this new revision of the order removes the prohibition on selling merchandise, so any non-food items. So that will be, I think, in keeping with our opening up of retail stores, it's appropriate that we now are able to have non-food items at our farmers markets. As well, eating at tables will be allowed in a similar way to how we have restrictions around pubs and restaurants. So it'll be small numbers and spaced apart. But I think that's an important thing as well, because we know how important it is to have these community places where we can buy fresh food and where we can have access to some of the local crafts and arts. I also want to talk today for a minute about the impact of COVID-19 on the overdose crises, our other public health emergency that continues here in British Columbia. Yesterday, the Coroner's Service reported once again a notable and very disheartening increase in illicit drug toxicity deaths. We had 117 people who died in April from an illicit drug overdose. These are our family. These are our community members. They're mostly our sons, our nephews, our cousins, our brothers and sisters. Most of them are between the ages of 20 and 50. So these are young people. These are our young men, in more than women, in our society. And we know that most of them are dying alone. And part of that is because of the challenges that they face around admitting that they are using drugs and getting the supports that they need. We know there is stigma associated with people who use drugs, and that is one of the things that we need to overcome. We also know for those who are facing things like homelessness and mental health and substance use disorder, COVID-19 and all of the measures that we've had in place to stop this virus is an added challenge. I want people in British Columbia to know that while I stand up here most days sharing the information that we have around COVID-19, we also are mindful of this other public health crisis that continues unabated in our province. And we are working hard to ensure that we continue to address that emergency as well. There is a lot of work being done to support the emergency, and people are not forgotten. We know that we need to continue our activities to ensure that there's access to a safer supply of drugs. We know the toxicity of the street drugs in British Columbia and across North America right now has increased. And we know that the situations that we're in and the anxieties and the challenges that we're facing with physical distancing, with challenges with access to food security, these are things that make the situation even worse for people who are using drugs. It is a complex problem, as I have said many times, and there are many pieces that need to go into the solution. And we have not forgotten that, and we continue to push. I also want to just mention that we continue to have access to our survey, the province-wide survey, Your Story, Our Future, and I encourage everybody to take part in that. Over 330,000 people have completed this survey so far, but we have several more days to go, so please do look at that. And I do want to thank the BC CDC Foundation for Public Health. It is the philanthropic arm, if you will, of the BC CDC, and much of the support for some of the important public health research, including this survey, has come from that foundation and partner with that foundation. We all want to get back to what we know we have in British Columbia, healthy, vibrant, and safe communities. By working together and supporting each other in kindness and in care, we will make that happen. So let's continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. I want to join Dr. Henry on behalf of the Premier, on behalf of the province, in expressing our condolences to the two people who passed away in long-term care in Fraser Health in the last 24-hour reporting period. I think it continues to be a difficult thing. I hear from people every day about how challenging it is for those working in long-term care, and I'm going to have more to say about that in a moment, but also for family members in these very, very challenging times. And so we want to express our condolences, our solidarity with the sorrow of people who have lost loved ones to COVID-19, and we are going to continue to do everything we can to limit transmission of COVID-19 in British Columbia. I wanted to also note, as Dr. Henry did, the report of the coroner yesterday, 117 overdose deaths this month, 114 last month, is 117 and 114 too many. And we have to continue our efforts, particularly in these times. And you've seen some extraordinary efforts, especially those led by community organizations, led by health authorities in recent months to try and address this situation. And we're going to continue to work on this together, because it is our other health emergency, or COVID-19 is our other health emergency. There are two health emergencies, and those 117 people and their families would also like to express my condolences and my sense of sorrow with them today at the loss of their loved ones. As Dr. Henry has said, we have 33 people hospitalized with COVID-19 today. That's down 4 from yesterday's report. We have 6 in critical care. That's down 7. To put it in context, we're over 5,000 emergency room visits yesterday, 5,141. So people are, again, continuing to use emergency rooms, and dramatically, as we spoke about yesterday, and significantly using urgent and primary care centers in BC, and they have done in record numbers during the period of COVID-19, and we're very grateful to all those working in those in our 17 urgent and primary care centers across the province, be they pharmacists, be they nurses, be they doctors, be they counselors, be they social workers, be they medical office administrators, or many others who do an extraordinary job every day in our UPCCs and have really delivered at a time when people really needed their help. So I want to express my appreciation to them. As well, I wanted to note that the overall occupancy in hospitals is up to 70%, and occupancy in ICUs is up to 52.5%. I want to acknowledge the changes that Dr. Henry has talked about for farmers markets. I want to acknowledge my colleague in the legislature, Norm Letnick, my colleague in the cabinet, Minister of Agriculture, Lana Popham, who know these areas very well and have communicated with us both the concerns and the aspirations of people to be safe while going to farmers markets in BC. So I wanted to thank them as well. I'm going to just give 2 updates that I'm now giving on Thursday. The first is about the single site staffing initiative, that update, and then one about surgeries. I want to start the single site initiative update with a correction. The total number of sites identified has been adjusted downward from 545 to 533. So that's 12 less. This change results from a determination there was some double counting of some sites where, for example, there was assisted living and long-term care on a single site. And so the adjustment also impacts the number of sites with completed plans, which moves from 497 from 499. Accordingly, we have 533 facilities hosting multiple facility employees going into this change, with a total of 7,350 employees who worked at multiple facilities. Here's where we stand now. Of the 533 facilities, 497, essentially the same as last week, have completed their single-site plan. That's 121 in Interior Health, 141 in Fraser Health, 94 in Vancouver Coastal Health, 106 in Island Health, and 35 in Northern Health. We don't, of course, make progress or talk about the 36 sites where it's not filled, but there is movement in all 36 of those sites. The majority of those 36 remaining sites are assisted living sites. And the ministry continues to work with health authorities to gather detailed information on current compensation from the non-Health Employer Association of BC sites. That's an important question. As you know, we are raising up salaries to ensure that workers support and are part of this initiative. This is a significant difference between the single site initiative in British Columbia and other jurisdictions who are attempting the same thing. It's a fundamental reason for our success. To support this work, the ministry has worked with legal services, health authorities, and industry partners to develop a provincial template and process. We held a webinar on May 26th with 250 participants and a second webinar in the coming days to ensure all organizations can hear the presentation and raise questions and concerns. The money, and will be retroactive to the single site order, but the additional money and support of healthcare workers will come in the middle of June, but it'll be retroactive, so people will get their full compensation, those that will see their wages rise under the single site initiative. And so I wanted to express my appreciation to everyone involved in the process. I wanted to note that the work in long-term care in BC has been challenging as it is everywhere else, and there's been talk about it a lot in the national discussion in the last few days. And I am, of course, saddened that we've lost 93 people, residents who live in long-term care. It is a blow to everyone, especially those who work with them, who provide care with them, and of course their families, and of course their communities. I think that British Columbia, though, can be proud of its long-term care workers, of its long-term care facilities. We've adopted, from the beginning, a Team BC approach to how we deal with this issue. We've, from the very first days, and I'll recall, Dr. Henry will recall, because for us, preparing for the briefing that day, the first day that an outbreak was reported at the Lynn Valley Care Home was an extraordinarily emotional day for us, because we understood from the information we'd received from Hubei Province and other things the vulnerability of people living in long-term care. And that vulnerability has been shown everywhere in the world. But in BC, because we've worked together, because of the extraordinary work of medical health officers like Dr. Patricia Daly in Vancouver Coastal Health, we have, in many respects, had a better situation. Certainly our 93 deaths compared to thousands in other places demonstrates that. And the things that we've done together, and I mean unions and the BC care providers and the denominational health associations and health authorities working together. It means in BC we were the first in Canada to ensure that long-term care homes that were not health authority owned and operated were integrated into the supply chain for PPE, which is a critical factor in British Columbia in controlling the spread of the infection. Of course, the challenge of restricting visits, which was put in place. The actions of our rapid response team, this extraordinary work of infection control specialists across the system, people who work for health authorities and have devoted themselves to this work. The single site initiative, which I think is significant and transformative to the quality of care. The support that we've given to the care providers and denominational health, for example, to invest in infection control materials, the $10 million that happened in March, early on in the process, to start to address gaps in the system. And of course, the move to increase care standards that started in 2017, the move to ensure that healthcare workers were treated fairly with Bill 47 passed unanimously in the legislature. We are going to continue on this path together in BC, a Team BC approach that involves everyone, that recognizes the quality of all of the people involved. And so we are delighted, of course, that other levels of government, that the federal government is interested in this, and we are going to focus on continuing to improve access in the system, including the need to rebuild long-term care facilities that are older in BC to modern standards, the need to have a plan to improve health, human resources, and the number of people working in long-term care, which we are going to need in the future, a new generation of healthcare workers. So we are encouraged to involve everybody in a serious, focused, practical effort to improve the lives of residents and to improve the work of workers in long-term care. That's what should be important right now, and that's what we're committed to do, and I'm so proud of all our teams and all the work that they've done. I want to also update you on progress on surgery. On March 16th, as you know, we delayed all non-urgent elective surgeries, or what I prefer to call scheduled surgeries. Our estimate of the total number of surgeries postponed in the 2-month period which followed was approximately 30,000. As you know, we continue to provide urgent scheduled surgeries and emergency or emergent surgeries in that time. From March 16th to May 17th, doctors, nurses, and healthcare workers completed 23,385 such surgeries, or approximately 2,600 a week. This week, the number of completed surgeries is 27,349. That's an increase of 3,817. That's significant. And we are continuing to work and to build on this week unto week unto week. On May 7th, we announced our commitment to surgery renewal that had been postponed due to COVID-19. It takes time to schedule patients. I wanted to say that we continue to make progress on this. By May 13th, 6,884 people across BC had been contacted by staff to discuss rescheduling their surgeries. That number is increased to 12,016. By May 17th, we have now contacted 17,978 patients, an increase of a further almost 6,000 from May 17th. All of this progress represents an extraordinary achievement by our surgeons, our nurses, our healthcare workers, and our health sciences professionals, and we are grateful to each and every one of them. To me, it's clear that everyone involved in providing the same energy and helping people waiting for surgeries as we provided in our response to COVID-19 is a fundamental commitment. It's also clear that everyone involved needs to do what they need to do in the operating room. For them to do that, we need to ensure we're doing what we need to do to prevent a resurgence of COVID-19. Our target timelines are clear. On May 31st, we want all contracted private surgical facilities working at maximum capacity. And by June 15th, all existing operating rooms running at full capacity. From June 15th to October 15th, we will add resources and capacity by extending daily hours of operation, adding Saturdays and Sundays to the schedule, and opening new operating rooms. We will remain focused on caring for those patients who need surgery most, and on patients it is the safest to care for. Our surgery renewal commitment is our commitment to patients, and it is available on the Ministry of Health webpage. The progress we've made and the plan itself shows the commitment to surgical renewal means to all of us. It also shows the commitment surgery renewal requires from each of us, of how much depends on each of us continuing to stay 100% committed to what Dr. Henry and our medical health officers have asked us to do. A surge in new cases or a second wave this fall will put our progress at risk. So I'd ask all of us to consider the power each of us has, each and every day to shape our BC experience with COVID-19, and the power each and every one of us has to fulfill our surgery renewal commitment. It is a tremendous power, one that is anchored in staying 100% all in an effort to stop the spread. Aujourd'hui, nous annonçons 9 nouveaux cas pour un total de 2558 cas de COVID-19 en Colombie-Britannique. Il y a 2 nouveaux décès liés au COVID-19 dans la région de santé de Fraser, pour un total de 164 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Parmi l'ensemble des cas confirmés de COVID-19, 33 personnes sont actuellement hospitalisées, dont 6 en soins intensifs. Je veux vous informer de nos progrès en chirurgie. Nous avons maintenant contacté 17 978 patients, soit une hausse de 5 962 depuis le 17 mai. Tous ces progrès représentent une réalisation extraordinaire pour nos chirurgiens, nos infirmières et nos infirmiers, nos travailleurs de la santé et nos professionnels des sciences de la santé. Et nous leur sommes reconnaissants. Thank you very much. We're happy to take your questions.
Thank you. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You are limited to one question only, please. Please unmute your phones. You will not be audible until I call your name. First question is from Maria Weisgarber, CTV.
Oh, hi, Dr. Henry. Just wanted to ask about the reopening of some park amenities across Metro Vancouver. A lot of playgrounds are going to be reopening over the coming days and some other facilities, although it varies from city to city. Can you tell me what's your view on the timing of this reopening for that kind of outdoor recreation, particularly for playgrounds? And what's your advice to anybody going back into these areas that have been closed for months?
Yeah, so we're quite excited about that, actually, and we've been working on some guidance just to give municipalities. Many of these playgrounds and parks are part of municipal closures, so as municipalities are looking at how they can open them up again, and of course next week when we see schools and increased use of childcare centres, these are important venues for children as well. So we know it has to be done safely. And again, it comes down to the very basics, making sure that we have small numbers of children, trying to avoid physical contact. We know sometimes, particularly with young children, it's hard to measure out 2 meters. And so really the focus is on preventing physical contact between young children and the importance of hand hygiene. And from a municipal point of view, or from the people who are managing these parks and playgrounds, then making sure that there's adequate cleaning, and particularly in the washrooms, that washrooms are accessible, that they're cleaned regularly, and that there's measures put in place to reduce the numbers of people who are using them at any one time. And we feel that with this type of important basic measures, that we know that these can be safely used by people, and I think that's a really great thing for us now, and particularly as the weather is getting nice. I will add the other caveat, of course, is that it's incumbent on all of us to stay away and to keep our children home if we're not feeling well or they're not feeling well, because that's the risk that we have when we have people playing together and connecting.
Next question is from Rob Shaw, Vancouver Sun.
Oh, hi, Dr. Henry. Yesterday, Alberta's Chief Medical Health Officer talked about the province's plan to become an NHL host city, and she laid out approval for what's called a cohort quarantine proposal, where entire teams or perhaps multiple teams quarantine together with staff and league officials. They have 3 hotels, designated pathways and travel routes between the hotels to the arena. And she said that satisfies the kind of compromise between the federal 2-week quarantine and the NHL's want for flexibility. So I wondered is BC considering any type of similar kind of mass cohort quarantine? And what do you see as the risk and safety of Alberta's proposal there?
Yeah, so I can't really comment on Alberta's proposal. We certainly have been talking about how it could be done safely in British Columbia as well. And, you know, the bottom line is I have not seen any proposal, certainly not any written proposal from the NHL of how this could propose to be worked, so it's hard to respond to what we think they might be thinking. But I do see how we could potentially have small numbers of people cohorting together and in self-isolation, for example, in a hotel, and management monitored regularly. And I know if anybody could do that, then the NHL is probably set up to do it. So I can see how we could have something like that work in British Columbia as well.
Richard Zussman, Global News.
Dr. Henry, there's a push in a number of communities, including Whistler, to start attracting people back. What's the messaging around timing of when these staycations should start happening? Because one of the things that we're hearing from a place like Whistler is that they're already getting ready for this sort of unofficial start to summer as early as this weekend.
Yeah, well, we've been talking about the next phase 3 phase 4, I don't know. We should stop calling them phases. Anyway, the next phase that we've been looking more at hotels and resorts and that sort of opening up and that staycation. So really what we're looking at, and in my mind, how I think about it is in relation to the virus. And so we are starting slowly, and as we talked about, we know the incubation period is 2 weeks. So we are watching very carefully now, because as things are opening up, we may start to see cases increase. If we can do that in a slow and measured way, then by the middle of June, we should absolutely be able to move out a little bit more. But we still want to stay within, if we think about back to our modeling, we don't want our contacts to go back to where they were before. And that's why the focus has been on how can we do things that are sustainable. So yes, I do think come middle, maybe end of June, if things continue in the way that we're looking, and certainly into July, if things continue without having peaks and dramatic increases in numbers of cases in the next couple of weeks, then that's the period that we should be looking at. But it will be different. It will not be large numbers of people coming together. We will still have to have our physical distancing, our hand hygiene, our staying away when we're sick, and small numbers of people, so that we're not extending our contacts so much that this virus can take off. So those are the things that we're looking at, but I'm very hopeful. I would look forward to going to Whistler myself or to one of the Gulf Islands once we get to that place. So yeah, I think that's what we should be aiming for.
Next question is from Chad Clausen, CFJC.
Hey, thanks, Dr. Henry, for taking my. This is in relation to overdose numbers. I know you touched on it a little bit before about the impact of COVID-19 around sort of the drug supply, tainted drug supply, as some experts say. There's been also some fraud out there across the province, and certainly here in Kamloops, with people, low-income people, benefiting and having more money in their pocket to spend on drugs and that. What specifically can the province do to curb this problem?
Yeah, we've been dealing with this, and I have been consumed with dealing with this for a long time. And there is no single one thing that we can do. We need to continue to do many things. And as you know, I do believe, and we've seen evidence from our partners in public safety, that the toxicity has increased. And part of that is due to the supply chains being cut off, as they have been for many other things. And drugs then being either manufactured locally or cut with other materials that are toxic as well. And I think that has quite a bit to do with the numbers that we're seeing. We also think that there's some impact on people receiving amounts of money, and of course those people who are dealing drugs are taking advantage of people who are in that position. We also know that, with this increased toxicity, with the challenges that we have with providing services, particularly to people who use drugs who are homeless or underhoused, access to overdose prevention sites has been interrupted in some places. And we've had to change those models, and we've seen that here in Victoria and in Vancouver as well, and certainly in the interior. So those types of things are different. The access to recovery homes and access to some of the in-person treatment services has also been interrupted, as has many other medical services over the last few months. So how do we switch that over to being able to support people who use drugs in a virtual way? That's been a challenge for many people, particularly if they don't have access to the internet even, for example. And a number of the initiatives that we've started, like increased access to pharmaceutical alternatives to street drugs, that has been gradually, slowly increasing. And I talked about this last week, not as fast as widespread as we would like to see. And there's started to be some uptake with clinicians in the interior, which is good news. People being able to access drugs like hydromorphone in place of their street drugs. I think the other one that I have talked about many times is the importance of the reduction in stigma and in particular the stigma that is associated with criminalization of people who use drugs. So I continue to push for decriminalization of people who have possession of small amounts of drugs for their own use as a way to try and reduce those barriers, so people who are using at home, and we know that this is, young men in particular in our province, that they are able to reach out to family and friends. And at this time of social or physical distancing and isolating, particularly in the last few months where we've been isolating at home, this is a very risky situation for people who end up using alone because they are afraid or are ashamed to talk to their family or their friends or their close circle about their drug use. So these are all things that we need to address, and as Minister Dix said, we have not forgotten this, and it has been underlying many of our discussions. Some of the critical needs that were being seen when we ended up with the public safety issues in Oppenheimer Park and here in Victoria and Topaz Park. One of the underpinnings of the response to that from public health has been being able to provide those people who were being offered hotel rooms and other forms of more secure shelter, the supports that they need for overdose prevention and for access to safe supply. So those initiatives continue, and we are working to ensure, with the Ministry of Mental Health and Addictions as well, to ensure that we continue to increase those services around the province. And that is a long-term strategy. It is not just for today.
Next question is from Tanya Fletcher, CBC.
Hi, Dr. Henry. Toronto and Montreal have now released COVID-19 data specific to postal codes or neighborhoods. I know you've talked about this in the past and have cited privacy reasons, and you've said, you don't want to act that as a deterrent for people to let down their guard if they don't think it's in their community. But can you explain again why the BC CDC can't release data that is more localized by health region, especially now as we're seeing fewer and fewer cases?
Yeah. I think part of that is one of the reasons, and we have talked about this, and we are looking at other ways that we can look at having more geographic representations. The challenge that we face, and it's the challenge that I talked to with my colleagues in Toronto even very recently, is you look at the heat map and it's based on numbers, and it doesn't tell you a story that you need to know to understand this. It does tell you that COVID cases were everywhere in Toronto. Our convention in public health is that we label cases by where they live. So it doesn't tell you where they might have been exposed. It doesn't tell you what community the risk was in. So those are the challenges that we face. I think the important thing that they show in the city of Toronto is that there are some of the lower income neighborhoods or more ethnically diverse neighborhoods are one that seem to have people who live there seem to be more affected. And that type of data is what we are trying to look at here in BC as well. We do find the challenge that we actually have few cases in many parts of the province. So again, it becomes identifiable information quite quickly. So we have to balance that. But yes, we will continue to look at this, and I'm hopeful that we'll have some more geographic representation in the coming days. We will be presenting some more data information next week as well.
And just one small thing in addition to that, we have a few more days, I think until May 31st, to complete the survey, which, and we really need participation from around the province. Dr. Henry talked about it. We've had, I think, 330,000 responses to the survey. I did an event yesterday with the Vietnamese Canadian community to encourage participation there. But we need to hear from everyone, hear from all regions, and ensure that all regions are represented. And that analysis and it's the impact of COVID-19 on all populations is what the purpose of that survey is. We really take this as another occasion to make the case that people go. It's www.bccdc.ca/COVID-19 survey and fill it out. We've got a few more days, and we really want to hear from as many people as possible from every part of BC.
Next question is from Marcella Bernardo, News 1130.
Hi, thank you both for taking my question today. Minister Dix, you made a point of saying today that 93 people have died in long-term care homes, and that works out to almost 57% of everybody who's died in British Columbia dying in a long-term care home. Do you feel that enough is being done in places like Langley Lodge and other places where we're seeing clusters popping up, and wondering what can we do to protect these people so that it's easier for families to try to get into contact with them again?
It's such a hard question, and we know that, and I know from talking to my colleagues and the teams that have been in long-term care homes and the care providers there, when this virus gets into long-term care, residents can get sick very, very quickly, and they may have very few symptoms, and so it's very challenging to control it. We are learning as we go, of course. We learned a lot from the initial response at Lynn Valley to the fact that people can be feeling just a little bit off and die very quickly from it. So yes, we have done a lot. I think that the SWAT team approach that we've been using in care homes has served us well here in BC, and the measures that we put in all care homes at the beginning were really critical. The challenge is it's hard to measure what might have happened had we not done those. We can only, by analogy, look at what happens in other places. So, restricting of visitors means that the people who are in the home are the ones that are likely to be affected and to bring the virus into the facility, for example. So it's so hard to prove the negative. So it's unclear which of the measures had the most effect. But we know that reducing the numbers of people in that community means that we reduce the chances that the virus will be introduced. And then, of course, our testing strategies to make sure that we are testing everybody as soon as we see a positive, to make sure that we're as sensitive as we can to try and protect and isolate people who have been who've not yet been exposed. So it's a very challenging problem. Lynn Valley is.
And I just want to say that today I talked to Deborah Hauptman, who's the director of Langley Lodge, and I just want to reach out to the people working there and to Deborah, who has worked her guts out for the people of Langley Lodge. I think a care home that, by the way, is generally regarded in independent reports as an excellent care home, and it shows us why we have to be vigilant right at the beginning, in the first briefings that Dr. Henry gave. We talked about the vulnerability of people in long-term care, the vulnerability of people over 80. Of all people over 80 in the major Hubei province study at the beginning, it showed mortality rate of 14%, and that is not adding on the comorbidities that occur when people have, for that group of people who live in long-term care. And so this has been a critical response that people have put everything into, because when it comes into a care home, and we've seen it in really 4 cases. 4 cases represent roughly 67 of all the care home deaths, and in all those cases it's because the spread of widespread contagion in that single care home. And I just want to say that the people there are working hard. They're fundamentally committed to the people that they serve, and I want to reach out to them today and say that shows how difficult it is, how necessary these measures are. Some people have said, well, the fact that there have been this many deaths compared to Ontario and Quebec or Ireland or France or the United States or whatever is a sign that you can now relax measures. The truth is, as Dr. Henry has said, that we don't know the specific impact of the measures, but we know that the large number of measures that have been taken have had a positive effect, and yet we have a situation which people are struggling with in different parts of the province that have occurred even now, even in May, even after we have flattened to a significant degree the curve. So I just want to reach out to those people today. I think the people working at Langley Lodge, the care aides, the staff, the leadership there are of course as affected, are more effective than anyone could possibly imagine but what's happened. But they are are there and with people today, and I admire them for their commitment. And we've got to continue to be that committed for people in long-term care, and it's why everybody out there, I would say Marcella has to remember their commitment to the people who need surgery and the people in long-term care. Because when we engage in physical distancing out there, we stop the transmission of COVID-19, and those people, our elders, are the most vulnerable to that. It's our commitment to one another, and I really encourage people to continue to be, as I sometimes say, 100% all in.
Next question is from April Lawrence, Check News.
Oh, hi, Dr. Henry. Thank you so much. Just wondering, with camping reservations opening this week, there were people from BC who've booked camping here on Vancouver Island. There's islanders who've booked camping elsewhere in the province, but there are still non-essential travel restrictions on BC ferries. I was just wondering if there's a timeline for that restriction to be removed from the ferries, or a rough estimate as to when that will be removed, and if it will be removed in time for camping season.
Yeah, so the restrictions are from Transport Canada, and they're on the numbers and the percentage of the deck space that can be what am I trying to say? Can be filled. So they have to be at half capacity. And we are still recommending that people limit their travel. We're not yet at that 2 incubation periods from when we started this, but this is our time when we're going to start to slowly move a bit more. Maybe not this weekend, but the next weekend. So when camping really gets going. I don't know when Transport Canada is planning on easing the restrictions that they've imposed upon the capacity limits. I know BC Ferries is increasing the routes and increasing the numbers of sailings over the coming weeks.
So we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Shannon Waters, BC Today.
Hi, this is a question for both of you. The Agriculture Minister announced this Job Connector program in an effort to address the anticipated labour shortage in various parts of BC's agriculture sector today. And I've spoken to a berry farmer here in BC who says the program is welcome, but the real problem is that there are a lot of contracted farm workers who would normally be coming to work in BC, and they're stuck overseas in countries, she used the example of India. And I recognize this is federal jurisdiction, but I wanted to ask the health minister, when are we going to start repatriating these Canadians, and how is BC working to ensure that Ottawa has its eye on this particular ball? And for Dr. Henry, can you just confirm that when they do return to BC, they would still be subject to that 14-day quarantine period that is being imposed on people returning to the province? Thank you.
Yeah, imposed. Yes, absolutely. We have actively been having temporary foreign workers come in. The temporary foreign worker program, there's a number of programs that the federal government supports. So there have been several thousand workers who have come in to support agriculture. And I know there are more. So this is something we actively are talking about with the federal government on an ongoing basis. And yes, there is a federal quarantine order on all of the people who come in. And here in BC, that quarantine is done at a quarantine facility that the province supports. So the federal government pays the wages of the workers coming in for the 14-day quarantine, and we put them up in a hotel where their health is monitored and they're supported. And that's because we had an outbreak, as you're aware, in a group of temporary foreign workers who had come in earlier on in the pandemic in March, and that they were in very good accommodations, relatively speaking, for temporary foreign workers, but there was not that ability to keep them from mixing, and there was transmission within the worker community. So we don't want to take that chance and have that happen in a variety of different farms around the province. So we're doing it centrally here in BC. That's happening in a number of other provinces across the country as well, in Ontario, and today we were just talking about that on our federal call. So yes, this is something we're very aware of. We are trying to continue to have those necessary supports to our agriculture industry come into the country, but they will be required to quarantine, and there's a very good reason for that. We've picked up at least a dozen people who have brought COVID with them and become ill while they were in quarantine, and this allowed us to be able to ensure they got the support that they need, but also that they didn't transmit it to each other or to our communities in BC.
Well, obviously, BC has been extremely committed to this question. BC's approach to ensuring that temporary foreign workers are safe coming into the country, and that communities and agricultural communities are also safe has been critical. We're the province engaging in this policy because we believe that we can continue to support our agricultural sector, but it doesn't do anyone any good to have, for example, the 12 workers who would have gone to farms otherwise and did test positive for COVID-19, caused broader infection in the community. That would have had, I think everyone can agree, a profound and negative effect on the health of British Columbians, but also on the whole community of workers that is working in our agriculture industry. So those are critical things that are still in place. Quite right, this is a federal initiative. I think you referred to Canadians coming home. I don't think there are restrictions except practical restrictions such as flight restrictions for Canadians returning home to Canada. What we have stronger restrictions on are non-essential workers, and so these and for visitors to Canada, and I expect those restrictions to continue for some time. As you know, the federal government's agreement with the United States, current agreement is to June 21st, and I expect that to continue on after that. And that affects obviously international travel. There's simply less international travel right now, and that affects industries such as the agriculture industry. But this is what we're dealing with. This and is a worldwide pandemic, which profoundly affects all of us. And so these measures are necessary, and that's why the actions that Minister Popham took today are so important, I think, to help support agricultural industries through this period and ensure support for our food security, for our agricultural production, which is such a key part of our economy, while keeping everybody as safe as possible from COVID-19. Thank you very much. Dr. Henry, we'll see you on Saturday, and we'll have a report for you at 3 o'clock tomorrow, Friday. Take care.
Thank you.